Hello and welcome to Consistency Goal Swing. I am Frank Drollinger, developer of the core balance free release method of Consistency Goal Swing. I'm really proud that today we are hosting the orthopedist and accident surgeon, medical doctor Dietmar Göbel from Germany for our video series on the subject of golf and health. Medical doctor Dietmar Göbel has been a member of our scientific team at Consistency Goal Swing for many years. Based on his experience in competitive sports, he is able to distinguish and anatomically evaluate the biomechanics of golf. Let's give him a very warm welcome.
My name is Dr.
Dietmar Göbel. I'm a specialist in orthopedics, and trauma surgery, a doctor in sports medicine and physical therapy, chiropractic therapy. I'm also qualified in acupuncture and neural therapy. I can see from this that I'm very intensively dealing with the musculoskeletal system and avoiding joint damage while promoting healthy movement. My personal background certainly speaks for itself and also clearly says why I have chosen this medical combination. I've been a gymnast at the national team level. This means that even as a teenager, I was intensively dealing with complex movement patterns, in this case with gymnastics. That is also true today, where I have my own practice together with a partner in the Black Forest, a very important point in my patient treatment and patient guidance. Here we have a lot to do with skiers, complex movement patterns and racing, but also here in our neighborhood with a lot of golfers. This means that I myself try to keep the patient active in life by treating damages to joints, but above all, by helping them avoid such damages.
Vor allen Dingen aber die Vermeidung von solchen Schäden, meine Patienten aktiv im Leben zu halten.
Keeping my patients active in life is, for me, the most important mission of the modern doctor. I don't want to go as far as saying that the orthopedist is the most important doctor of them all. But of course, there is a kernel of truth in every bold statement. If we avoid arthritis and joint damage, damage to muscles, ligaments, and joints, then we can move and work against civilian diseases and the lack of movement of the 21st century. We can also partially prevent heart attacks, sugar diseases, dementia, Alzheimer's disease, cancer, or even reduce their probability of development.
Teilweise verhindern bzw. in ihrer Wahrscheinlichkeit der Entstehung reduzieren. Und deswegen ist der Bewegungsapparat.
That is why the musculoskeletal system, at least today in the 21st century, has become a very important part of medicine, and it is enormously important. If we practice sport and live an active life to eliminate pathological movements this way.
Dr. Göbel, a myth that we have to clear up is the statement that about 85% of tour players are injured by the unstructured imbalance method, but amateurs are not. Do hobby golfers have an even higher risk of injury than tour players due to the lateral shear forces and torsions? If so, why?
Meines Erachtens ist es.
In my opinion, it is absolutely illogical that tour players have a lower or higher risk of injury. You can't exactly balance that out. The decisive factor is how wrong the posture of the professional or amateur player is, in case of doubt.
Der Profispieler oder der Amateur.
For example, there may be amateurs who seem to be at a higher risk of injury due to the civilization strain at the desk. This causes muscle shortening in the pelvis and in the lumbar spine area, which they do not compensate for by appropriately stretching or other forms of training. It may also be the case that a young professional who attaches less importance to compensation training, or who does not carry it out in such a concentrated and motivated manner, also can have a pelvic malfunction and thus an increased risk of injury. General statements that a professional or amateur has a higher or lower risk of injury are ultimately not possible. It is clear that shearing forces and a movement pattern that is not tolerated by the normal physiological anatomy naturally damage the musculoskeletal system.
We would like to thank Dietmar very much for this great information. We are very excited about what Mr. Göbel can tell us about golf and health. If you would like to learn more about golf and health, then please subscribe to this channel and you will be able to view the next video.